Okay, so the first thing I talked about was brain dysfunction. I told you my mother passed away. She had Alzheimer's probably for the last 5 years of her life. So I really think this is important. I think the patients are really interested in it. And as functional medicine docs, if your brain and your memory is not functioning well, I know this from a personal experience. You are really not who you are when you can't remember your life and the people who are important in your life. So this is very important to me because I feel like the last 4 or 5 years of my mother's life, she really was not there. So as functional medicine docs, we gotta focus on trying to keep our patient's brain healthy. So what's the demands of the brain? All the bad stuff that we know we shouldn't do, it affects the brain. Not enough sleep, wheat gluten, high carbohydrates. So we know all of that. All right. Frontal lobe is where the action is. That's what makes you you. And when that is not functioning well, you're not yourself. And also, you have socially unacceptable behaviors because this is what this is kind of your instinctive things that you do: fear, fight, feed, and fornicate. You have to have a well-conditioned frontal lobe in order not to do this at the inappropriate time. So it's very important to keep that frontal lobe healthy. Also, the temporal lobe is where memory is located. And it's also important in distinguishing smells. I just saw something a week or two before we had our conference saying that they were looking at early signs of Alzheimer's by how well someone could smell peanut butter and how far away they could smell it. So these are small things that you can look at and know that you may need to look at someone's brain function. Now, I had another one here. Uh, Maybe I didn't. But also in the temporal lobe is where the hippocampus is. I don't know how they got the hippocampus is there, and that sets the cortisol rhythm, the day-night cortisol, high in the morning, low at night. When that cortisol rhythm is off, that is a sign that the hippocampus and the temporal lobe is not functioning well. So if you're doing 4-point cortisols, when those are abnormal, that is an indication that you may need to be looking at brain function, memory function, and so on and so forth. Now, when the brain is working well, most of the energy of the brain should be going through the parasympathetic nervous system. The parasympathetic nervous system is what prepares you for stress. It is your rest and digest. You need to rest and you need to digest and take in nutrients in order to be ready to handle. Okay, the parasympathetic nervous system is your rest and digest system. You can separate out the parasympathetic from the sympathetic by looking at how the distances between heartbeats. The parasympathetic nervous system is going to slow the heartbeat down. Sympathetic nervous system is going to speed it up. It's just like in OB, where you have to look at this long and short-term variability. The more irregular the lines are, the better that baby is doing, because the parasympathetic and sympathetic are working together to prepare the baby for small stressors. And when the contraction comes, the sympathetic nervous system kicks into gear, but the parasympathetic nervous system is able to handle that stress and to bring back this variability because the parasympathetic nervous system is kicked back in. When you don't have variability, this is a problem for the baby. The baby is under physiologic stress. When that physiologic stress continues for a long period of time, organ systems begin to not work well. Usually it's the gut first, it's the brain is the first one in the baby. That's why you see these babies with cerebral palsy, and the first thing they go to is through the heart rate variability of that baby to prove that the doctor either did or did not act in time. Well, if we have poor heart rate variability for a long period of time, organ systems begin to fail. The brain, the memory begins to fail. The gut begins to fail. And that's why they're saying that looking at heart rate variability are looking at the diminishing effect of the parasympathetic nervous system can be an early sign that things are going awry, and that allows you to intervene and to try and correct that physiologic stress. That's what we did with the babies. We would turn the contractions down, we would increase the fluids, we would increase the oxygen to try and to allow that stressful situation to subside. And if it did, the heart rate variability returned. The same thing is true when you do this in an adult. If you can get rid of the stress, let's say it's an infection in the gut, let's say it's inflammation somewhere else, it's a dietary intolerance, it's a B factor deficiency. They have a vitamin B deficiency. You will see that the heart rate variability is diminished, and then when you correct it, it will return. So I love this in the office. It's just an invaluable tool. Any factor that increases parasympathetic function will lead to a good outcome. Anything that increases sympathetic function or autonomic function, sympathetic autonomic function, will lead to an adverse effect. So let's move on. I don't want to spend too much time with this. I want to get to the nuts and bolts of this. This is a good heart rate variability strip. This will show you parasympathetic, sympathetic. This is a poor one. This is a cortisol pattern. Cortisol does not react quickly. This is looking at quick reactions to small little stressors, but mostly those long lines that shows that there's a long distance between heartbeats. The parasympathetic nervous system is working well while the person is supine. This is while the person is supine. The person stands up, which is a stressor. The body now has to react to this change in position. It has to pump blood up against gravity to get to the head. You have to be able to tighten up muscles so you can stand up without falling. Your balance system has to be put into effect. And we also turn the lights on, so your eyes have to constrict. All of this happens right here. This is like a contraction and upside down. The sympathetic nervous system kicks in to make all of those changes. And then after that, the person is still remaining standing, but now they are in a restful or rest and digest situation, even though they're standing up. So we have rest and digest. We have a stimulation of the sympathetic nervous system, and then we go back into a resting state. When you are under chronic stress, when you don't have the neurotransmitters to make epinephrine, norepinephrine, serotonin, dopamine, and GABA, you have to rely on cortisol. Cortisol cannot make quick changes. It is the same all the time. Cortisol is a daily pattern, a monthly pattern. It's not a heartbeat to heartbeat pattern. So you get this flat line. This is what you see when people have adrenal fatigue. This is the people who don't have the energy to get up out of bed. These are the people who can't sleep. You actually have to have energy. You have to have neurotransmitters to sleep. So these patients will be tired and they won't be able to sleep. You can see this without doing the cortisol pattern. And if you give them the building blocks for neurotransmitters, you will see that this increases. They have just run out of their neurotransmitters. You can do that because, well, we'll talk about that in a minute. Okay, so that is the HRV. Cortisol is a daily pattern. Neurotransmitters are quick on, quick off. But we know that most people have low serotonin, but they also have low epinephrine and norepinephrine. That's why you're using these stimulants. So people are low in neurotransmitters. How do you increase neurotransmitters? You increase them by giving them amino acids. I use amino acid therapy orally and IV, and I get amazing results by giving branch chain amino acids. I don't usually give them singularly. I usually give them in all at one time, all the 22 amino acids. So let me make sure we don't have any questions. Again, you can also write your questions here. I don't want to talk about things you're not interested in. So this is a perfect HRV. This is somebody who used to work with me. This variability here is what you want to see. That's the same as a line going up and down when you're looking at a baby. This is the stress of standing up, And then this is, this is the resting state. There's a lot more you can do with this, but I'm just trying to go over some quick ones. Again, this is poor heart rate variability. You see there's hardly no change when she stands up. The way I explain this is that the patient has had so much stress for so long, standing up does not even register as a stressful event. So they don't make the necessary changes for that. And this is just showing you a system that will eventually just tire out and wear out. Again, this is adrenal fatigue. So just want to show that. One thing we use for that is not only amino acids, but also phosphatidylserine. Phosphatidylserine helps to reestablish this negative feedback loop when patients have high cortisol. The other thing that can make patients not sleep, one is having not enough of the amino acids for rest and digest, which is serotonin and GABA. The other one is if you have too high a cortisol, and phosphatidylserine helps to lower elevated cortisols throughout the day, but especially nighttime cortisols that can prevent people from sleeping. So let me go to this other one real quick. And then if you have any questions about hormones, we can do that too. So I want to talk about the 6 keys to brain health. I want to talk about the CNS-VS test because these are two really quick tests that you could implement in your office very quickly, and you would be amazed at the information that you get and the things that you can do to intervene. So 6 keys to brain health: balanced glucose and adequate oxygen. Too much glucose has been associated with Alzheimer's, so you want to make sure glucose is balanced. Also, you need enough oxygen to the brain because the brain uses so much energy all the time that you need to make sure that you have enough oxygen going to the brain. And we'll talk about a test you can use for that too. Essential fats and phospholipids. I'm going to talk about lipid exchange really quickly. You can send me questions if you have others, but that's another thing that we use in the office. We get amazing results by using phosphatidylcholine and glutathione IV and mixing it with some red blood cells. Patients get much improvement in that CNS-VS test that we talked about. Having amino acids and other intelligent nutrients, herpesine, GPC, alpha glucose phosphate. I'll show that to you in a minute. Voluntary movement. And they showed in rats that if you force them to do things, that their memory doesn't improve. But if it's voluntary movement, it does. Decrease stress, especially inflammation. If you remember, I showed you how you can visually see an inflamed brain and how it is slowed by inflammation. And increasing SRRT, this increases mitochondrial function in the brain. And SRRT is increased primarily by calorie restriction. And we do very low calorie diets in the office. And patients will say that they feel like their brain works better when they're on a restricted calorie diet, primarily due to the ketosis that we create. The brain likes ketones. It increases mitochondrial function. So those are the 6 keys to brain health. And we'll quickly talk about how you can look at that in the office. Oh, you used to promote phosphorylated serine. Is that something you still advocate? Yeah, phosphorylated serine actually comes from phosphatidylserine. In the products that I use, I tried to find phosphorylated serine, but I found that phosphorylated serine comes from phosphatidylserine. So you can use either one. But both of them seem to work well. So that was one question. So feel free to put your questions in there. So let me try and get through this. I want to show you the CNS-VS test. I really do. So I really want to show you how. Okay, so we talked about glucose. We know about glucose control and all this, but also nitric oxide. This is a great book, No More Heart Disease. I don't know how many of you know about digital pulse analysis. You can read about it in the No More Heart Disease. This guy won a Nobel Prize for this, figuring out, and we heard Dr. Bryan, again, I'm not going to talk about that, but I do want to talk about this digital pulse analysis, which is another thing that you can use in the office that is insurance reimbursable if anybody is interested. But it looks at the pulse wave and the digits, and based on how restricted the vessels are, the pulse wave that comes to the digit will be bigger. The way I explain it is, if you see a wave in the ocean, by the time it comes to the shore, it's a little ripple because the ocean is so vast and wide open. If you're in a river and there is a flood, and if the river is flooded and it's coming towards you, then there's nowhere for that energy to go. So that wave is either going to be the same intensity or it's going to be bigger. So the more constricted your blood vessels are, the bigger that wave that's coming to the digits. That second wave here. This is the first wave out of the heart. This is how much energy is taken away because of the flexibility of the vessels. And this is the wave coming to the digit. The less flexible the vessels, the smaller the first wave and the bigger the second wave. This is very important for prevention of strokes, or getting enough oxygen to the brain. The less flexible the vessel is, the more likely it is to be occluded by a small clot, and the less it's going to be able to expand to allow blood to flow around it. So the digital pulse analysis is a way to look at, is there enough oxygen and or glucose going to the brain, and are the vessels open enough to allow this to happen. You can use nitric oxide or you can use arginine in order to increase the flexibility of the vessels, and you will see it reflected in this test. I see all the time, I will see levels 3 and 4 go to a level 2. Some even level 5s go to a level 3 and 4 and a level 2, only after about 2 or 3 months of arginine, okay, or nitric oxide. All right, so that's that. We know about inflammation. Neuroinflammation also shuts down the production in brain cells, leading to mental fatigue and possibly depression. Just want to show you this. This is a test called Evoke. Now, this is much more expensive. I use the CNSVS. I will use this also. But this is a mini EEG. It gives you the brain waves just like an EEG, and it puts it in color coding. All right. Blue is slow transmission. Green is normal. Red is being over transmitted or increased transmission. Okay. So you see this area is there's a lot of blue areas here, and that means that there is a decrease in transmission. Now that can be due to inflammation, not enough neurotransmitters, not enough good fats. So there are a lot of things that can be going on. Also, what it looks at is an evoked potential to see if you see a stimulus like a light or a sound, how quickly does it get processed? How quickly does your brain pay attention to it? And how quickly does it process that information? So these are all slow. So this person will have problems with attention and problems with converting short-term into long-term memory. I'll go through this. This is a food sensitivity test. They had a lot of inflammation, and I'll show you how that looked. This is inflammation primarily in that frontal lobe. And remember, the frontal lobe is what needs the most energy. The frontal lobe is what makes you have socially acceptable behavior. Also, this over here is the temporal lobe, and so this would also be where you would have your learning centers, so you would be slow to learn. Now, after removing the foods, we see that her decision-making speed and her reaction time increased. This is probably about halfway through the therapy here, and she wasn't coming in as often as we wanted, but you can see that there is some improvement. This is a person who we did, let's see, this is another person that we did. Now, she was exposed to some paints. Her dad owned a paint factory when she was small, and after some IV detoxification with her, you see several things change. This is really about a year later, and that's how long it can take. But you can see several things improved in her. Good fats, neurotransmitters, we talked about that before. Now, this is probably the most important thing, is that we have so many people on proton pump inhibitors, and you have to have acid in the stomach in order to break down proteins into amino acids. Now, I just want to show you here, I didn't get a lot of time to show you this, but proteins, to go into any amino acids, it requires stomach acid. So if we miss this step, you need stomach acids, you need zinc, and we know a lot of people are deficient in zinc, and you need B vitamins. If you don't have this, then you're not going to get any amino acids. I'm amazed. On that heart rate variability, there's something called the total power, and I'm kind of going fast, so I didn't show you that, but total power shows you the power of the sympathetic nervous system and the parasympathetic nervous system. Routinely, anybody over 40, the least it should be is 1,000. I would tell you that 90% of my patients, their total power is less than 500. And I would tell you that probably 40% of my patients, their total power is less than 300. So if the total power is down, that means that they are extremely deficient in amino acids. And if you don't have amino acids, you don't make neurotransmitters, you don't make enzymes. We know that Dr. Ward was talking about enzymes. You can't make things. All of those are made from proteins. Your muscle is made out of proteins. But it all starts up here with stomach acid. And we have a doc who we know very well who almost died from proton pump inhibitors. His bones were getting weak. He was just a mess. He stopped those, started taking amino acids. He's a new man. He's a cardiologist. But if you do heart rate variability, you will see most people have low heart rate variability. And now I will also tell you that you can be young and have low heart rate variability. I think I have that case here, but anyway, I would tell you that most of the young people I see have low heart rate variability and have low total power, primarily because of the stress that these students go through. This is the guy right here. Before me, this is the total power. Total power 210. This is a Vanderbilt University student. He's a senior. The guy has low libido. He has low libido and also has erectile dysfunction. Why would you have erectile dysfunction? Because the parasympathetic nervous system controls erections. His total power is 210. In someone his age, it should be really over 3,000. This guy's 21. I told you anybody over 40, 1,000 is acceptable. It's not great, but it's acceptable. This is his parasympathetic activity. You see he doesn't have a lot of long lines. Well, we treated him with amino acids, and after 1 month, he calls me and says everything is working better. And with if you know men, that's the only thing they're worried about, working better. But then after 3 months, his total power went up to 2,046. This guy has been on antidepressants since he was a sophomore in high school because he was tired. He was really just stressed out from school. I'm seeing people younger and younger on antidepressants, and you see the total power is very, very low. This is very good for me to explain to the patient and to the parents how we could correct this problem without keeping that child on antidepressants for the rest of their life. So I love heart rate variability. It really does allow you to just objectively show a lot of things to patients and gets them interested in your therapy. And also, you get to retest them. It's very easy for the patient to see the difference between that one and this one. Very easy to see. So it allows you to prove that your therapy is also working. Now this guy needed amino acids. Now, let's say that there was some inflammatory process going on. If you get rid of the inflammatory process, the HRV is going to improve.
Whatever you do for that patient, if you decrease the physiologic stress, you're going to be able to see it in this heart rate variability. Now, they do need to have enough amino acids and neurotransmitters to show you that reaction. So you may still, even though you're correcting the problem, you still may need to give them amino acids so that they can show you that they're better. All right. So if you have any questions, again, you can raise your click that little hand thing, and it'll show that you're raising your hand. All right. We'll go through that. I'll show you CNSVS. I think I have that in here. Okay, acetylcholine. That's the other amino acid. Well, the other neurotransmitter is not really amino acids. It's acetylcholine. Impairment of acetylcholine is the earliest sign of Alzheimer's disease. You lose photographic and verbal memory, convert short-term to long-term memory in the hippocampus, and acetylcholine deficiency symptoms are identical to early Alzheimer's. Foods that are rich in choline are liver, organ meats, egg yolk, beef, tofu, nuts, cream, milk fat, and fatty cheeses. Also, lecithin, alpha GPC is what I was trying to say before. Alpha GPC is well-absorbed phospholipid metabolite isolated from lecithin. So alpha GPC can easily cross the blood-brain barrier. Dosage is 400 to 1200 milligrams a day. So this is the precursor for choline. Also, L-herpesine A decreases the breakdown of acetylcholine. Both have been shown to aid in memory, cognition, and increase brain plasticity. So these are two things that we use in the office. We have a product called CogMed that we use, but we use this in association with, and let me just show you, this is looking at promising therapeutics for natural bioactive compounds for improving learning and memory, a review of randomized trials. And if you look at the randomized trial, herpesine A has the most randomized trials that prove that it does increase memory. If you look over here, affect patients with mild to moderate Alzheimer's disease, it shows significant improvement in cognitive function of all tests. So herpesine A probably has the most information about it. Glutathione is very important. It's a chelator. It helps to remove the environmental compounds. Glutathione, again, there's a whole book about glutathione, the nervous system. We use phosphatidylcholine and glutathione in an IV. It's called a lipid exchange. If you're interested in it, you can email me. But we use it, we give it once a week IV, and then we also use our product CogMed and Flamex. Flamex is to decrease brain inflammation. CogMed has herpesine A and alpha GPC and bacopa and some other things in it to improve brain function. And we usually do this when we do a CNSVS test. In your handout, I have a promotion for CNSVS. If you use the coupon code AFMA, it gives you a discount on the test. Usually the test is $35. It's a computer test, and they charge you $35 every time you do the test. If you go into use the coupon code AFMA, it'll be $30 for you forever. The other thing is I think they give you 10 free tests. I would encourage you to just go and take one of the tests yourself. It's a computerized test. It's Medicare reimbursable, and it shows all of this psychomotor speed. It's really looking at frontal lobe and temporal lobe function. And whenever I see low average or very low, I usually do the CogMed and Flamex, and we do the IVs once a week for 6 weeks. And usually we get major improvements. You can see a lot of low average and very low. Now there's only one low average and no very low. This is another one. We see a lot of very low and low. And this is a follow-up. One very low, no low. And you continue to do this, and it gets better. I know this patient, she was really a very smart woman, felt like she was incapacitated. We fixed hormones. and we gave her the IVs, and we gave her the Cogmet, and she is so much better. She's continuing to use the products, but this, if I was going to tell you to do something that you could do right now, is implement the CNS-VS test. Second thing I would tell you to do is to do the heart rate variability. The third thing I would tell you to do is a digital pulse analysis. Those are things that you can add to your office very quickly. Let me show you. Let me see if there's anything else I want to talk to you about. Oh, mitochondria. It's mitochondrial function. I know some of you guys are probably already doing the organics test, but I just want to show you this stuff about calorie restriction. Okay, increases mitochondrial protein, and it increases longevity. Again, the only thing that's been shown to increase lifespan is calorie restriction, and this may be one of the reasons why. When you use calorie restriction and resveratrol, you get increase in mitochondria, and there's more mitochondria per square whatever in the brain than anywhere else. So you get a decrease in metabolic disease, cardiovascular disease, mitochondrial disorders, and neurological disorders. So I just want to put that in there. There's no problem with doing very low calorie diets as long as the nutrition is there. We use them in our office. Dr. Andre, we'll have him on here soon so he can talk about more weight loss options. But even just calorie restriction, not even for weight loss, just decrease the number of calories that you take in. You can eat a lot of food at very low calories. The amount of food and the amount of calories are not necessarily, they don't necessarily coincide. So you can eat a lot of food and still be on calorie restriction. And that is a way that you increase your lifespan. So it's good for the brain. There's also hyperbaric oxygen. People who go scuba diving that are having an increased oxygen concentration are getting these hyperbaric chambers. That's also been shown to increase brain function. So look up SIRT3. It's something that I hadn't really heard of, but that is why calorie restriction and hyperbaric oxygen chambers, that's why they work. Let's see what else we'll talk about. So principles of brain health. Let me see what time it is. And then if I need to say a little bit about hormones, you guys have all heard about that. Are the neurons receiving enough oxygen, glucose, and stimulation? You can do digital pulse analysis with that. You can do blood sugar analysis, whatever. Are blood sugar issues, poor liver function, inflammation, hormonal imbalances, or lack of neurotransmitter activity promoting brain degeneration? And again, you can look at heart rate variability. You can say, hey, if there's not much heart rate variability, something is out of whack. I need to look for what are the causes, or what is the cause of what are the causes. Is plasticity, the ability of the brain to learn and adapt to change, being promoted in a positive or negative direction. So we didn't talk much about plasticity, but you can, your brain can make new connections, and it can make new connections for good, or it can make new connections for bad. When you're looking at post-traumatic stress, this is making connections for bad. It's making connections to say you should be fearful of everything. Everything is a threat. Or you can have plasticity because you're learning new things. Because of my mother's history with Alzheimer's and a couple other people in the family, ballroom dancing is a way that you can enhance brain function, because you have to know where you are in space, and you have to kind of learn these moves. So I've been ballroom dancing for 2 years. We absolutely love it. I do it because I like it, and I do it because I'm trying to make new connections in my brain. So maybe next year we'll entice you to come back, and my wife and I will do a ballroom dance routine in one of the breaks. So we'll see. Are the neurons receiving enough oxygen? We talked about digital pulse analysis, glucose check for insulin stimulation, mental and physical. To control blood sugar, you can use alpha lipoic acid. For liver function, we can talk about BIA. Again, you can look at those, and we can talk about those at another date. Activity promoting brain generation. All right, so that's it. So now the only